A main concern when implementing any new program or process for clinical teams is how it could possibly affect their current workflows. How would the clinical teams perceive this new program? Our team was really aware for the RPM program to succeed, we needed to ensure there was a solution that would be minimally disruptive to the clinicians or the clinical team members involved. We wanted to make it easy for these providers to learn the process and to adapt to any new workflows. During the planning period for this integration, we heavily valued provider input and what was important for a clinician from their perspective. Dr. David Bollinger from the pilot program with Novant Health Bariatric Solutions shares his perspective on including EMR integration with the RPM program setup. He says, EMR integration is crucial to an effective RPM program on multiple levels. From our OBGYN program, Dr. Jalima Speaks from the Novant Health Woman Care in Winston-Salem shares her thoughts on the EMR integration. She says, completing an EMR integration allows the clinician's process of enrolling a patient into the program to be completed with ease. Now I want to dig into how Clinician Connect and Epic work together to support our documentation workflow. So how the integration works. To ensure the process was easily adapted by our providers, we built our workflow to originate in our EMR system, which is Epic. When the provider identifies a patient to be enrolled into the RPM program, the provider places an order referring the patient to remote patient monitoring. When the provider signs this order, the connection between Epic and HRS is initiated. So essentially, this is what links the two systems together. Then our Epic system sends the patient's name, date of birth, and medical record number into the HRS portal, which creates them a patient profile. When the patient begins sending their data remotely using the HRS platform, the information is monitored in the Clinician Connect portal, and then our integration is set up to then send all those newly transmitted vitals, any clinical notes that were made, and the time spent applicable for this encounter into that patient's Epic chart. The documentation is then easily accessible to any necessary clinical team or care team reviewing the patient's medical record without additional logins to the HRS portal. This really allows our clinical monitoring team to work out of both platforms as they need, but also provides the clinicians and the other team members to see all the information in Epic alone.